Welcome to the MRCS Bites session on hip joint. Today, we'll dive into this topic and explore the common questions tested during the MRCS Part B exam. For more information and full course, please visit mrcsbites.com. What type of joint is the hip joint, and what movements does it allow? The hip joint is a ball and socket synovial joint formed by the articulation between the head of the femur and the acetabulum of the pelvis. This type of joint allows for a wide range of movements, including flexion, extension, abduction, adduction, internal rotation, external rotation, and circumduction. Which bones form the hip joint? The hip joint is formed by two main bones, the femur and the pelvis. The head of the femur fits into the acetabulum, a cup-like cavity on the lateral aspect of the pelvis, which is formed by the fusion of the ilium, ischium, and pubis bones. What is the main function of the acetabular labrum? The acetabular labrum is a fibrocartilaginous ring that surrounds the rim of the acetabulum. Its main function is to deepen the hip socket, which provides increased stability to the joint by enhancing the fit between the femoral head and the acetabulum. It also helps to distribute load across the joint and absorb shock during movement. Name the primary ligaments that stabilize the hip joint. The primary ligaments that stabilize the hip joint include the iliofemoral ligament, which is the strongest and prevents hyperextension, the pubofemoral ligament, which limits abduction and extension, the ischiofemoral ligament, which reinforces the capsule posteriorly and limits internal rotation. Together, these ligaments help maintain joint stability during various movements. What muscles are responsible for hip flexion? The main muscles responsible for hip flexion are the iliopsoas, composed of the psoas major and iliacus muscles, rectus, femoris, and sartorius. Additionally, the tensor fasciae latae assists in hip flexion. These muscles work together to lift the thigh toward the abdomen. For more MRCS Part B resources, please visit mrcsbites.com.